Hello, everyone, and welcome to another episode of the Cycle Podcast. I have Maggie with us today. Welcome to the show, Maggie. How are
Hi,
you?
I'm great. Thank you so much for having me, Melissa.
Thank you for being here. Appreciate it. Look forward to getting to know you more and a little bit more about your journey with endo. But why don't you start off by just telling the audience a little bit about yourself?
Absolutely. So again, I'm Maggie. I'm Maggie Boyer. I live in North Carolina. I have three cats that are like my babies. I feel like so many of us have animals. I feel like it's so good. It's too amazing to have a pet if you're able to have one. And they're like my whole life. I've also been a writer for most of my life, and I am now a published author. I have almost three books out. So we'll get there, but yeah, so I have endo. Obviously, I also have a myriad of other chronic pain disorders, including fibromyalgia. And yeah, I really just love writing, talking to my cats, talking to my friends online, and just doing life. Gardening has become a really big thing for me lately, so I feel like a lot of people are getting into gardening, so I like to throw that one out there.
During this time period when we have more time at home, I feel like, yes, definitely gardening has been on the up and up. Well, I look forward to kind of diving into how you do that if you're not feeling well and if you feel like it's therapeutic.
Absolutely. Yeah. I think that we've looked at, so I have a partner who does this stuff with me. So it does make things a lot easier. And I know not everybody is that lucky to have such like a supportive system, but if you do, it's just amazing. But I typically do the harvesting. So every day I just go out and midday when I'm feeling good and I just pick a couple like tomatoes, whatever's like looking ripe. And he does the heavy lifting and the repotting. So I think that if you can have anyone help you with that part of the process, the rest of it's so much easier, more low maintenance than it looks.
I laugh because my husband loves to have a garden and he has a huge, crazy garden. And I'm always like, this was your choice. But I don't mind going to harvest. Because it's like, it's so amazing that that you just grew your own food.
And you get a little bit of sun while you're out there.
Yeah.
I think that it's really hard for me to get sun sometimes because I do get like migraines outside. So I put my sunglasses on and I go outside, but it's just nice to get like 5 minutes of sun and just get just a little bit of that vitamin D. And I think that's the perfect way to do it because I personally love cooking. I don't know about anybody else. I do a lot of mindfulness stuff, so we'll talk about that probably a little bit more later. But I found it really hard to do body mind. I don't know if anybody else, probably everybody else, has that experience where it's painful to be in your body. And so being more attentive and more mindful of your body can be really hard.
Yeah.
And so I do stuff like the kitchen. I have a stool in my kitchen so that I can go in there even on not my worst days, but a little bit worse days, I can still go in there and I just love to throw some spices, some fresh vegetables, and the taste is just so good. So I feel like you can focus on other things to be mindful, and that's really been helpful. So
it's almost like cooking is like a creative outlet for a lot of people, right? Like mixing things together. And I'm
making
not
new recipes.
Yeah, I'm not a big cook, but that wouldn't be my area of choice.
Right.
I'm not good at mixing things, but I know a lot of people who find it very I like doing the dishes. That's like therapeutic to me.
Yeah.
So cooking is similar.
Exactly. You just got to find what you can be mindful during and stuff. Cause I totally get it when people are like, oh, mindfulness is way too hard. And I totally used to be like that because it was so hard to be in body mind. So you just finding ways to work around things I'm finding is the best. Some things you have to give up, but there's a lot that you can just kind of work around. And with the gardening, instead of doing in the ground plants, we do raised beds and pots and things like that because they're higher up for me to grab. So things like that make a big difference. But
I love that. I love that. I as we're talking about mindfulness, just while I'm thinking about it, I love to meditate. I talk about it all the time on the show, but since things have been kind of more agitated in the world lately, I've been really struggling to do it when I need it the most.
Yeah.
And what you're talking about, is like, I'm relating to that so much right now. Like even this morning, I just really tried, and my brain just, I couldn't stop. So sometimes like
Going.
just putting on like your favorite song, or like a very calming song. And if you feel up for it, going for a walk around the block, or a walk around even in my backyard, like walking around just for a few minutes, like it helps to just feel like the grass on your feet. I know it sounds like kind of woo, but it
Corny
really,
or whatever.
yeah, but it really has made a difference in my life, you know. And when I get into like very acute, either mental or physical pain, like if I can force myself to get some like deep breathing in, I do notice like there's like this relaxation that comes from that, and it does release a little bit.
Yeah, I like, we do have a parasympathetic nervous system. Like it's not going to like take away your endo pain itself at all. Like
Right.
I think that a lot of people are under that misconception. They're like, oh, people say they do mindfulness
Right.
and they feel great all of a sudden.
Right.
I'm like, no, that's not
No,
it. It's just
it can
about being present
calm.
enough for the joy too, because I think
Yeah.
that
Yes.
we'll talk about my journey, and this is kind of a great segue almost into this, but like there was so long that I just wasn't in my body at all, that I didn't realize how bad things had gotten. And the only things that would break through like a disassociative state were pain. And so then your whole life is just the pain. When you're more grounded, you kind of experience worse pain. I truly think I experience worse pain actually being mindful, but I also experience joy, which makes the pain more worth it and
Yeah.
creates like a life worth living when I feel that pain.
Yeah.
So
That I told right, because it's almost like an avoidance. I know what you're saying. For me, like I just hold myself very, very, very tight. And I really didn't realize that until I started to like learn how to breathe. And that's so yeah, I was still in the pain, but like when I say release, like I felt like, oh my gosh, like I'm so tense all the time because I'm just like this ball of pain, you know? So
yeah,
it helped me, like you even just did that motion. Like I would always just, I noticed I was like just crunched over and like, yeah. And I was like, oh my gosh, like this breathing like helped me kind of just like open up. Like my body was, I was so protective of everything, you know?
yeah, it's natural to like tense around a pain,
Yeah.
but when you're in chronic pain, it creates like more pain.
Yeah. Right. And you're just, anyway, let's jump into, I feel like we could talk forever, which is
Right.
phenomenal and so helpful. So yeah. So how did things, start off for you in your endo story?
So looking back now, I realized that like my GI and my urinary symptoms started well before my other symptoms. And I like, this is embarrassing to say to the world, but like, I started having accidents and stuff when I was 8,
Yeah.
and it was like I had been fine for years. Like, I was potty trained, of course, like at 8, you're potty trained.
Right.
But I just started, or like having urinary urgency and just like not being able to get there in time and stuff like that was starting to happen. But everybody just thought like maybe it was an emotional thing. My parents were going through a divorce. So everybody was just kind of like, you've got a lot of stress in your life. That's probably it. And then I started my period. And I started my period when I was 10. It was a month almost to the day after my 10th birthday. Um, elementary school had just closed for me a month before I started my period. So like I was a kid, and I tell anybody, like, I mean, when you're 14 too and you start your period, you're still a kid. Like,
Yeah.
and so I tell people like kids don't know how to deal with that, like at all.
Oh.
And so like I just started having horrible pain. And I remember like I thought my mom almost hadn't had to talk with me yet because she didn't start her period till she was like 14.
Right.
And so she was not expecting like just me to
When
come
you
out of the
just
bathroom at
turned
Hobby
10.
Lobby and like,
Yeah.
Mom, I think I murdered someone. I don't know what's happening.
Right. At that age, it's not even on your radar.
Yeah, I was just like, I don't know if I'm dying. I don't know if I killed someone. Like, I don't know what's happening. I just know I need to get home. And I remember like my mom told me that I would not like pads. So she just immediately started me on tampons. And because we were at the beach too. So like, she was just like, let's go. And any youngins out there, trust me, there are other options and you can try them all and find what works best for you.
Yes.
Please.
Great
I suffered
advice.
for way too many years, just not knowing that there were other things out there. So
Yeah.
putting that out there for
Yes.
everyone.
Yes.
So I like, of course, was begging like to go to the hospital, like all the doctor. I'm like, I'm dying.
Right.
And it took honestly like a really long time to get people to believe me. My mom had a lot of health issues and mine flared around the same time as hers because she had endometriosis as well. And so we were flaring around the same times. And everybody was just like, you know, you just need attention, this, that, and the other. So it took a few years, but finally, like it had gotten so bad, I was taken to the hospital a few times. My GP thought I had appendicitis. I think we've all probably had that, all of us. My GP was like, you probably have a cyst or appendicitis. So I got an ultrasound, I got an MRI, I got a CT scan.
How old were you? Do you remember?
I was 12.
Okay.
So I got the whole 9 yards
So
at
young.
12 and nothing, you know, of course, they were just
Got
like,
nothing.
no cause. So they sent me to a GI because I was having still GI issues and stuff. So this is
What
like
were
4 years after.
those? What were some of the GI ishes you were having? Just
Yeah,
like
so I
stomach
have
aches.
so I do get stomach aches now. I'm actually diagnosed with abdominal migraines. So like basically just a lot of throwing up, which happened later. So we'll talk about abdominal
Okay.
migraines. But I was having like stomach cramps. I was also just having so much urgency. Like I just couldn't control it. Like
Right.
and I still am this way, like every hour at minimum, I have to use the bathroom. And I
Right.
know that some of that's pelvic floor, some of that's endo, like it's kind of
Sure.
a combo of all the things. But
Right.
urgency, pain with urination, with like no UTIs, just a couple accidents and just things like that. I think I had pain with using the restroom. I do now. So that's definitely, if you have pain with either like GI or urinary pain,
Yeah.
not normal.
Right.
Not
Totally
normal.
not normal. That's why I like to talk about the symptoms though. So thank you for saying that because it's so, you just don't relate the two things together.
Yeah.
Especially when you're young like that.
I'll talk about how like I really did not relate any of this to my like cycle at all for years and years.
Yeah.
So like and with that, with the urinary and like GI problems, the pain I get right before my period, to explain it to some people who might be wondering if they have like a similar pain, I get this like deep ache in my lower abdomen and my thighs. And like, I know I'm going to start my period in the next like 12 hours, you know, like it's coming. And I also get like that feeling. I know that endo doesn't technically like bleed and slosh, but I still feel like I have like abdominal wall bleeding. Like I feel like something's dripping on the inside.
Does
I
it
don't
feel
know.
like burning, like a burn, like almost like
I do get that. And I
Yeah.
think that that more relates to when I have cysts. Whenever I have a cyst, I get this like horrible constant burning. And then like I get burning stabs. So a lot of stabbing. I was going to say like I think a lot of people get them all, but like the wrapped in barbed wire. And so like anytime you move all the way from your hips to your chest, like, or to the bottom of your ribs, I get like that kind of pain. And then it's like acid. Acid was poured inside. And then sometimes there's some like nice hot knives that they can be in your abdomen. They can be up your rectum. They can be in the vagina. Like any of those things, you can have like burning knives. That's a big one.
Yeah, I remember before I would start my period young, like middle school, beginning of high school, I would know too, very similar to you. I'd get that pain in my thighs, but then I would get like someone was stabbing me in the rectum. Like, and it was, I wasn't even trying to go to the bathroom. It would be like, I'd be walking and I would be like, oh my gosh.
Those
and again, I thought it was normal. Like, I was just like, oh, everybody gets this.
Yeah. Right. Like, oh, it just make everybody cries on the toilet. Right. Like, but I don't like the problem for me. So we're almost to that in my story, but I started disassociating very early. And because I do have complex post-traumatic stress disorder. And so I like don't remember a lot of my early symptoms, but I always have remembered that burning ache and then some stabs up the vagina. And now I get like stabs in my rectum as well. And so there was some stabbing and then it was the burning. And then pretty quickly, I feel like it progressed. I also got like really bad stabbing at my appendix. So that's why
where we were, right? So your doctor, so you're 12 and they think appendicitis or you have a cyst, and then they say, you're fine.
Then they say you're fine. So they send me to a GI, and the GI, I'm 12 still, does a colonoscopy, which I woke up during
Oh my gosh.
because I was allergic to Demerol. So always write down your allergies when you're young. Like if you learn that you're allergic to something, write it down immediately, because like it was bad. And I found out I was allergic to a lot of sleep medicine. So I try and avoid sleep medicines when I'm looking at new medicines to take. Like if my doctor's like, here are 3 options or whatever, I'm going to avoid the more Ambien type.
I think that we're also, I don't know if it's the endo or what, because the inflammation, I just think that we're more sensitive. Like I am
So sensitive.
smells, chemicals,
Allergies,
medications,
all of it.
all of it. Yeah.
Yeah. And so I woke up and I told my mom this after the colonoscopy, and I was like, I woke up during it, and she was, there's no way you woke up, blah, blah, blah. And I hadn't seen the doctor beforehand. So I told her what he was wearing. And then he walks in and he's wearing that, and he goes, yeah, so Maggie woke up in hives during the colonoscopy.
Oh,
And we had to put me down with like another sedative. So I couldn't walk for multiple days. Like I literally like couldn't use my legs. Like I just remember like literally, I don't remember how I used the bathroom. I don't remember moving for like 3 days. And I almost like couldn't go on a mission trip because like I couldn't move until like the day before.
And 12.
Yeah. So that was so scary. So when they found nothing, they were like, go to a psychiatrist.
Of course.
Because I did have a lot of trauma. So this is now we're getting into that part of the story.
Yeah.
So I have complex PTSD from a lot of things. My mom was really sick when I was younger. So she had myasthenia gravis, Crohn's disease, endometriosis, a small hole in her heart, like a bunch of little like crazy things.
Right.
So that was pretty traumatic as a kid.
Yes.
And especially because my parents were divorced. So I was like the main one there. I'm the oldest sibling. Any other older siblings out there? Woo! We carry.
Yes. Caretakers.
I was gonna say, I know that younger siblings have their own mess to deal with. My partner is the youngest of 4, and I'm the oldest of 4. So we talk about that and kind of like look at each other's side. But yeah, it's definitely a different experience. And so my mom, trigger warning here for suicide. My mom did attempt suicide, and I was the one who found her. So that's when my PTSD got like really bad.
Yeah.
And I disassociated. So I disassociated from when I was 14 until about 18. I have few memories from this. And I do remember my period starting multiple times. And that's what's crazy to me. The few memories I have, most of them are that pain. Right. And that's why I tell people mindfulness is so good, because you don't want to lose just like years and only remember pain.
Yeah.
I just think it's so much better to like remember the pain and remember the good things now that I've experienced both.
Right.
So yeah, I remember I stopped going to the doctor because everybody's like, it's psychological. So I didn't go to the doctor, and I just disassociated, kind of like function through high school. I looked back at my like records, and in middle school, I missed between 39 and 44 days a year. And for hospital trips, for being sick, for the whole 9 yards. So
I mean, how many days are we in school? I think we're like 180.
180 or something. So I missed like so much of the schooling.
Right.
And I remember I had teachers that were really mean to me about it. So I just like tried my hardest to just be at school as much as possible, to just function. Just
force your way through it. Yeah.
Yeah. And so I think so many of us probably relate to that, where we just kind of forced ourselves through it at some point.
I remember being like, if I can just get there, this happened with work too. If I can just get there for the first couple hours, and then if it gets really bad, I'll come home, but at least it looked like I made an effort. Like I remember like, I didn't have those thoughts like rationally, like I should make sure I make an effort, but I would be like, you need to go. And if you don't feel good, you can always leave. And I was just like looking back at it now, I'm like, why did I even go? I was like laying on the floor.
It's okay, stay home, rest. Like
driving, like, whew. Yeah.
I feel like so this is like a big part of my story. I made myself so much worse pushing through. And that's where I'm at now. And so I like want people to hear that and like learn that like it's okay not to push yourself. Like it is okay to recognize your limits and to enforce boundaries.
Yes.
Like, oh my goodness.
I think we live in this culture though that's shifting, but that is, you're weaker if you you're so weak, you're failing if you don't do all of these things, right? And it's I put that pressure on myself.
You're a burden or a drain. Like, oh my goodness.
And it's okay to be like, I don't feel well, I'm going to stay home. There's nothing wrong with that, but it's just
anyone else who is sick like that would be staying home or be in the hospital. Like probably in the hospital.
Probably in the hospital. Yeah, for sure.
People are like, why don't you go to the hospital? And like, I'm applying for disability at this point, and we'll get there. But like, they're like, you know, why don't you go to the hospital and this, that, and the other for that pain? And I'm like, they're not going to do anything.
No point.
I have better access to pain management at my house than I would in the hospital.
Yeah.
And I'm just going to sit in a COVID infested hospital, like
waiting
in pain, waiting for 5 hours. And they're just going to say, go home, take Tylenol and have a heating pad. If I advocated really hard, I'd probably get pain meds.
That's it. Right. And after waiting 10 hours of trying to get them, like, it's not, I remember I had a cyst rupture once and I was home alone. My husband was out of town. I think he was my boyfriend at the time. We lived together and he was on a work trip. And I was like, should I take an Uber to go to the hospital or should I not? You know, and then I was like, I'm just going to wait it out. And I like,
see how it goes. If it passes by tomorrow.
Like, I was like, hopefully I'm, you know, I just remember, you know, the writhing back and forth in pain. I was like blacking out. And I just was like, there's no point in going.
Blackouts are the worst. Yeah. I feel like I've lost so many days to just like, and this happened like last week. I lost like 2 days because I had my period last week, if I hadn't said that already. Right. I'm still like at the tail end, but it's that point where it's just like, hey, if I have my heating pad, I can function. Right. Oh yeah, I'm ready to get back out there.
Right. All right. Let's go.
I feel like I get so excited at the end.
When you
say, like, I start to feel just a little bit better. I'm like, oh, it's a party.
That's a good thing. At least, like, you're like, I know there's an end in sight. I can feel good. Ooh. Oh my goodness. Okay. So
back to, I'm in high school.
Yeah.
I started working the day after I turned 16. I had already been working as a babysitter because, again, my parents were divorced. My mom was very sick. So I did bring in some of the money and things like that. And so I worked really hard in high school. I remember I was working 30 to 36 hours in high school and just way too hard pushing myself, because now that I have my fibro diagnosis, I look back and my fibro started when I was like 12 or 13, like after a few years of having bad endo pain, pretty much. Yeah. And so I basically like was disassociating, getting through work, getting through school. And I was 18 and I was a senior and I was a TA. And this is kind of the catalyst of going back to the doctor. I remember I just had this shooting pain down my arm and in my chest. And I was like, what is happening? And the world just started getting wonky. And I was like, I need to get out of here right now. And my TA, he was my professor a year before, so he loved me. And if I needed to step out to the bathroom, I could just walk out because I was a TA. And so I walk into the hallway and I remember struggling even to get there, just not sure I'd hit desks on the way or something. And I got out to the hallway and I fainted. And I woke up to somebody, like one of my classmates from another class, like over me, like, "Are you okay?" And I was like, we're good. And I ran to the bathroom pretty much like as fast as I could. And I got in the stall and I had to take off all my clothes because I was just dripping in sweat.
Yeah.
And that was the first time I had a chest attack that I remember. And I didn't know what it was at the time. Like I had no idea that thoracic endo even existed. I am not diagnosed.
Did you even know endo that you had?
I didn't know endo existed. My mom had an endo diagnosis, but didn't really. This was, 10 years ago when I started my period. 13 years ago, I'm 23. Right. So like my mom got an endo diagnosis. My brother is 9. No, is my brother 20? Oh my gosh. If my brother's 20, it was 20 years ago because my mom got an endo diagnosis right before having my brother. She had to get surgery to be able to have him. And like with me, it was fine. And a few years later, just between 3 years, she started having fertility problems. Right. Within 3 years of having me, started having fertility issues. And so she had my brother, and then she had a hysterectomy, and kept her ovaries though. And we all know hysterectomy does not cure endo because it is outside of the uterus. So still was having endo pain, just didn't know it. And so there was just so much less info about it. So I don't like blame her. My stepmom has endo too and didn't know that I had endo. Like,
right. At this whole point, like through high school and middle school, like that, no one thought about that because
no one thought about
symptoms you were having
were all over the place, and
right.
nobody connected that it was happening, like, because it happens between my ovulation and my period is when it's the worst. Like some people, it's worst on their period. My first 2 days of my period are really bad, but like the 48 hours before and the first 48 hours, that's like the worst of it.
Yeah.
And so I remember that chest attack, and then it happened again about 7 months later. And I was on a camping trip, and I was sitting at the table, and I just like put my head down, and I was like, whoo, I'm going to die. I'm going to die. I'm going to die out here in the woods. Like,
right.
And we did cold camping. So this was December. So I'm like camping in December and like having a flare where I'm dripping sweat.
You're like, I'm glad it's not
fainting.
summer at least.
And there's like a bunch of people around me. I like made them all go on the hike, and I was just like, I'm just gonna sit here half naked. Like, I don't know what's happening.
At this point, were you like, I don't know, like what's going on with me?
I don't know what's going on. I'm confused. I have no idea what's happening, but I was so resistant to go to the doctor. I was the worst. I like didn't go for physicals. I was awful after all of the other stuff, like for years. I was so bad. So that happens a few times. And by my sophomore year of college, by the time I'm 20, I am throwing up to 12 times a day. I'm not able to hold down food. I take one bite and I'm puking.
Yeah.
And I was the sulfuric burps. I don't know if anybody else gets those. I feel like that's a SIBO thing, but SIBO is really common because of endo. So like just those sulfuric burps. And so I weighed 80 pounds, and my friends were like, you have to go to the doctor. Yeah. And I was like, okay, you're right. Like I was missing 8 days of work a month because at that point, I think I worked at Whole Foods and I was a barista. So I'm working in food. Like I can't go to work when I'm throwing up. Yeah. And I wasn't connecting it with my period because it was starting a week before my period at that point. And I was always just like, oh, thank goodness I'm home when my period started, because this isn't like, I literally had that thought multiple times where I was just like, thank goodness I'm already home.
Right. Right. I know.
I didn't connect them at all. And so I just wanted to like describe the sulfuric burps and all that in case anybody else like has that kind of experience. And so I went back to the doctor, appendicitis checked through again, the whole CT scan, ultrasound, MRI, the whole 9 yards again, sent back to a GI. GI does another colonoscopy and endoscopy, finds that I have chronic inactive gastritis from all the years of being told to just take Tylenol and get through it. And he didn't find anything else. He was just like, yeah, you're fine. We'll just start you on amitriptyline to control your abdominal migraines, because I get migraines. So they were like, your stomach must have migraines. That's like a thing that happens in kids that are going to develop migraines usually. It can happen in adults, but it's rare in adults. So I don't know why they would diagnose me with something that's rare in adults when endo is so common. Because that's what just gets me, is I'm just like, oh my goodness, I had like classic presentations of like more severe endo, like, or more symptomatic, not like severe in depth, but like more symptomatic endo, because everybody has a range of symptoms, and some are just fertility. And that's not a just, by the way.
Right. No, for sure.
That's a big, so to the GI. And then by the grace of God, in 2019 in March, I saw an endometriosis awareness post on Instagram.
Just randomly, like, did a friend?
Okay. Their, like, hominess, like their home goods. Like she's actually a really close friend of mine now. So that's what's funny. So I like comment on the post, and I'm like, can I message you about this? Because like this sounds really familiar. Right. And so I start messaging her, and she like goes more into the symptoms, like the leg pain, the stabbing, the throwing up, the not able to go to work or school during your period or before. And that was the big distinction. Right. Because everybody says like you can only have endo pain on your period, and that is not
true
at all.
No.
Like I have endo pain every day of the month, but it's
Yeah.
just, it flares like cyclically, and it flares starting at ovulation. Like it doesn't flare the day
Correct.
my period starts.
Correct. Yes.
And I just want other people to like recognize, and it can be different for everybody. I feel like everybody has, and they kind of know their normal worst days, and you can have flare-ups outside of that, but like you can plan which days normally you're worst.
So yeah, and some people are worse in ovulation than the cycle, like you said.
Mhm.
Like it's, and that's what I'm like a broken record, but track
your symptoms.
That's
what I was about to say, because my chest attack is always at ovulation.
Right. We're going to take a quick break and we will be right back. Okay, everybody, we are back. Maggie was just talking about how she saw a post on Instagram and pretty much probably changed everything.
Yeah, it changed everything. I was going to say within 5 months, I got an official endo diagnosis because nobody had told me. So I started talking with her about the symptoms. And when you said track your symptoms, I think that's so important, because that's how I have convinced my doctors that I have thoracic endo, because basically what happens every month at ovulation, my heart rate spikes. I'm just sitting there, and I have literally, the worst one I had, I was sitting and I just fell on the floor, and my heart rate was at a 150. And I was sitting, and I got in the bath. I was sitting, I fell in between my door and my bathroom, like my front door and my bathroom. And so I after it starts just going down a little bit, I crawl to the bathtub and I get in the bath, and my heart rate was 120 to 130 for a while after. And I started tracking it, and I have a Fitbit. I recommend having one of these, especially if you think you have thoracic endo in particular, or something like that could affect your heart rate. My heart rate changes by 10 beats per minute on average with my cycle. So it's down here when I'm in my follicular phase, the first after my period, and till I ovulate. It's a normal heart rate. And then it spikes 10 resting heart rate beats. It's supposed to go up 2, by the way, everybody, 2.
Wow.
And so basically it was a lot. And so I started tracking it in March of this year, and exactly with my Fitbit.
You see the pattern now.
And you see the pattern. And I thought it was at my ovulation, but I wasn't positive until I got the Fitbit. And that also helped my doctors believe me. Because when you say my heart rate spikes and all these things, they might not believe you.
Right.
But having the proof that no, look, it's doing this. So right now we're just managing those symptoms with medication until I can see a thoracic surgeon. But basically I see this post on endometriosis on Instagram, and I go to my stepmom and I'm like, hey, you have endo. So I want to see your doctor. I go to her doctor, and this was in 2019. I'm 21. And he gives me a pelvic exam, and I cry, and he tells me unequivocally I do not have endometriosis.
That is not what you needed at that moment.
I was no, I'm pretty sure. I just cried during a pelvic exam. That's not normal. And he was like, no, that's pretty normal. I'm like, oh no. And so I start doing more research, and I find he actually did ablation. So I'm actually really thankful I didn't go to him and have actual surgery with him. But
Maggie, do you want to tell everyone why ablation might not be the best? I mean, there are.
So I have and everybody has different access. So if you get ablation, I'm not upset with you. I'm not I'm more upset with your doctor for not learning, and I'm more upset with the insurance system for not paying well enough for excision. But ablation basically is just burning the top layer of the endo off. And I, in particular, people who have deeply infiltrating endo, which you don't know if you have it or not until they excise it, it won't hit all the endo, and it won't destroy all the endo. it will leave the deep disease and it'll actually be harder to get to and to find.
Yeah.
And I have deeply infiltrating endometriosis. And so I'm really thankful I didn't get the burning on the top, because it can make some people more symptomatic. Again, though, everybody has different access. And if you need a diagnosis to get any sort of care and the only person you have access to does ablation, like, I totally understand.
Yeah.
And we do the best we can with the information we have at the time too, because there are other ways to get excision I also want to talk about.
Yeah. And I definitely want to get into that for sure. And I will say, I've had, I think, 2 people on the show that had ablation that they are feeling okay, but
yeah,
it didn't work for me. I mean, as everybody
my
who
stepmom
listens,
had ablation,
yeah,
and it allowed her to get pregnant, and she had 2 rainbow babies since having ablation. And my baby brothers are like my whole world. They're 5 and 4. Yeah, my stepmom did lose twins before, and so it was just like really special to have my little brothers. So
and so
ablation,
close in age too.
yeah,
That's so
and
nice.
so like ablation gave us my brothers. So
Right.
like, and she says her cycle is lighter and easier, but she still has GI symptoms. She still
And
has a lot of
pain.
the other symptoms.
Everybody do their research on that, but excision is the gold standard. But like Maggie
Right.
said, access to care is a challenge, but we're going to get into talking about ways around that.
So I searched and searched, and I found an endo center in my state, and there's only one, and it's at Chapel Hill, North Carolina. And I'm going to tell people this. I hope I don't get in trouble with the hospital. Do not go there. I have stopped going there because of a lot of bad things that happened with nurses. I write about it in my book. I think that some of us have had similar experiences where nurses push boundaries, and it's not appropriate. I also had like incomplete excision. So, but it was the only one in my state. So again, access, like what we have access to is what we can do.
Yeah.
So I basically got excision, and my deeply infiltrating endometriosis took her 40 minutes to excise, 3 lesions. And she told me that she got all the endo, perfect excision. When you look for a hospital, look and make sure that they're Joint Commission accredited. The hospital I went to had lost their Joint Commission accreditation at the same time that I got surgery there. Joint Commission accreditation is the only like big certification for a hospital meeting standards of care. They lost their accreditation for different reasons, but they should have lost it for a lot of reasons. It has been restored since, but that is important, because I also found her fellowship outline, and they spent a month on endo in the 2 years. So yeah, look, and if you are able to do the research and find that these things are like this, you need somebody who's doing like 400 excision surgeries a year. Like if you have access to that, like that is what you want to look for.
Yeah.
That is the gold standard, is that. Just because I want people to be informed of what the gold standard is, but I don't want anyone to feel like they're a failure if they can't access that gold standard. That's not on you. That's on a system.
Right. And some people have to, we haven't even talked about birth control, but some people only have access to birth control, which again was very challenging for myself, but
that was where I was at.
It helped.
And it depends on the type of endo. It depends on your person.
So
it
many
depends
things.
on how sensitive you are to medicine. It's so many things.
So many things. It's so individual. That's, I think, one of the biggest challenges too. There's just not one size fits all for this. Like, unfortunately, we're like live test subjects for ourselves.
Grant looks at me, my partner, and he's always like, you should be a case study.
I mean,
but so I got excision. It did not work, and my symptoms were back within 2 months and worse.
Sorry.
So I was on continuous birth control at that point. I was on continuous before my surgery as well, which was better for my symptoms. However, it did, I think, hide some of the endo or make it less dramatic that it is. But it worked for me for about a year until the symptoms got too severe. And with my fibromyalgia, like my joints were to the point that like I would cry making the bed. And I was like, I can't be on progesterone anymore because it's just like making my joints hurt so bad. And so I did get off of that. And I got sent to like GI again. I got sent all the other places, neurology for nerve pain. I did get a fibromyalgia diagnosis from a rheumatologist. And now, because of my family history, I have had 2 positive ANA tests, which is autoimmune antibodies. They have been low positives because I eat a completely anti-inflammatory diet. The first one, I was doing a decent job of my diet and it was a positive, but just like a medium positive. The second one, I had not had any inflammatory foods for myself, like what was inflammatory for me. I did an elimination diet in a year, and I had reduced my inflammation by half.
Wow.
So it was
incredible.
Yes, but it made the test borderline negative. So I didn't get a diagnosis.
Right.
So when I went to the rheumatologist this past week, which I think that a lot people with endo are at about double the increase risk for autoimmune diseases. It's still a smaller percentage. Like it's not like it's everybody, but I have family history and a lot of other things. So I do want to talk about it though, because there is a portion of people who deal with this.
100%,
And so
yeah, 100%.
I went to the rheumatologist again this week, and I actually did advocate for myself and actually got the tests again. And the week before, I ate everything I wanted. I ate all my trigger foods. And I said, you know what? We're just going to eat everything we want. We're going to get fast food. We're going to have Taco Bell, because I was about to have my period and I needed my inflammation to be higher.
For the test. Oh my goodness.
I want to know what this is so that I can more effectively treat it.
Right.
And not have to get so much more sick, because at my GP, my kidney functions and my liver functions were going down each test. And so my body was still fighting autoimmune, but the tests weren't coming up
showing it.
So I wasn't getting the treatment I needed. And so I'm waiting on those results.
I was going to say, did you get the results yet? So you haven't gotten the results yet?
But she did tell me that if they come up negative, she still thinks, because I have like rashes and ulcers and things like that. And so she was like, I'm going to recommend you go to a new academic center so that they can rule out more rare autoimmune diseases. Because my mom's is really rare. There's only like 60K cases of hers. Yeah. So it is good to get checked out for like all of them.
For sure. For sure.
So basically what I'm saying there is advocate for yourself.
Yeah.
And going back to advocating with my surgery. So I am talking to 2 new surgeons now. I am talking to one in state that is good, but I don't think that she does extra pelvic. And like we've said, pretty much my whole care team, my pelvic floor physical therapist, my fibro physical therapist, and my GP, like everybody thinks I have thoracic. So I want to get checked out. Yeah. I do think that if you have thoracic symptoms, including I cough a little bit of blood every few months at ovulation. Yeah. It's not every month though. Yay.
Thank goodness.
Right. I do get chest pain every ovulation. There's the occasional one I get to skip or that's not as bad, but I get that 150 heart rate. Then it's basically like I get stabbed in the chest, in the sternum, and to the right here, and then up my arm and down to my pinkies. And now, because I have fibromyalgia, my left side mimics it occasionally, but that is like once every 6 months, whereas this is like every month. And it's much less intense on this side. And so it's like it's trying to mimic the pain, because that's fibromyalgia is central sensitization, part of it. Right. And so it's normal for my body to do that with pain it recognizes, but it's much worse and much more severe on the right side. And it's every month, and it's coughing blood, and the heart rate increases. So I am talking to the Center for Endo Care in Atlanta. I'm waiting on my consult, my call. So fingers are crossed there. Maybe I'll get to come back and tell you guys more about how that kind of care goes and how more extra pelvic is dealt with.
Yes, we will definitely.
I do have confirmed extra pelvic. That was the other thing. I had deeply infiltrating endometriosis on my right uterosacral ligament. I had fibrotic tissue on my left uterosacral ligament that was dyed. Like I think it was dyed before because it was more than 5 millimeters in. So that's what deeply infiltrating endometriosis is, for anyone who doesn't know. It penetrates the peritoneum and can grow into the muscle or into the organ or the vein, like whatever it's growing towards.
Yeah.
So I had a fibrotic section there, and then I had a Allen Masterson window, which is like basically a little pocket that often hides endo. And in that, I had more endo in my perirectal space. So that is your rectal endometriosis. So it makes sense that it feels like flaming knives when I use the restroom.
Yes. Yes.
And that
absolutely.
I feel like for so long, this is something I want people to know. Don't judge yourself for taking pain medicine. I still do it. So it's not easier said than done.
Yeah.
But I have to use my pain medicine after I use the restroom every time. Don't feel bad. If it's 8 a.m. and you used the restroom and you're about to cry, like take your pain medicine. It's okay.
It's there for a reason. I mean,
Exactly.
it is there for a reason.
Yeah.
I mean, you had that surgery, you're not feeling great
That was
since that
2019.
surgery. Yeah. Now it's 2021 and you haven't really felt amazing. So right now the space you're in is you're managing with your diet and you're looking for a new doctor.
Yes. And I'm looking into what autoimmune conditions could cause other things, because
Sure.
multiple pain generators can only make the other ones worse. So it's a long process to figure out what each of your pain generators is, but it is important to do that.
Yeah.
I think often it's easy to chalk it all up to endo. And it's not always all endo, but it's also important to check. Like if you have extra pelvic symptoms and the basic rule outs find nothing, I think it is important to also pursue extra pelvic as the pain generator. It's not that rare.
Yeah, I can't say enough about if you have bowel or bladder symptoms before ovulation or your cycle, anytime. I had them nowhere near my cycle, and I always just thought, oh, I'm just one of those people that has bad stomach. Like that's what I thought for years. And I had a bowel obstruction. The endo had totally wrapped around my bowel. So it's important to get it checked for sure.
That's why I'm doing thoracic, because
it's important.
It could be my fibromyalgia, but if I'm coughing blood, it's important to rule out.
Yes.
Because it's important to figure out what is causing that symptom.
Yeah.
And that's the same for anyone. And I just so talking about excision real quick, because I just
tell us.
We're getting close, but talk about excision really quick, and then we'll move on. Maybe talk a little bit about my book for everybody.
I want to talk about all of your books, but let's talk about excision. But before we jump into that, what are some of the things you've been doing in the past couple of years to feel better? Like you mentioned your diet. Just tell us a little bit of, how are you managing things?
I did the Whole30 diet for 30 days. And then I did, I have a couple anti-inflammatory cookbooks that my stepmom loves. I eat mostly no meat. I occasionally have chicken, and I have fish. And then I eat a lot of veggies and a lot of quinoa and a lot of gluten-free. I don't do soda. And if I do, it's going to be a light soda, like a Sprite. I told my physical therapist I get a Sprite when I'm like really nauseous. And she was like, so it's not even for fun. It's for symptoms.
I used to do Sprite all the time when I was, it helps.
Right.
It helps.
Yeah. And so, I just kind of like reduce sugar when I do eat, when I get those cravings at luteal phase, like PMSing, I eat dark chocolate to get that iron up. Just kind of like looking for some of your, because I also take supplements, but your body doesn't absorb them as well as it does food. So it's always important to like eat dark chocolate. Like that's a win.
I love dark chocolate. It's my treat. There's a brand that I love. There's a lot of great brands. There's one called Hu, H-U, that you can get online there. You can get them on Amazon. You can get it direct from their site, but they use stevia. So there's no sugar, because I try to avoid sugar too, because inflammation. And then talking about soda, there's a brand called Zevia, which is also stevia sweetened. So there's no sugar in it. And they make ginger ale and root beer ginger ale, which were like my jam, because for obvious reasons. Yeah. But anyway,
that's amazing.
Keep going.
Yeah. So I also I was doing pelvic floor physical therapy. The reason I'm fairly certain that I still have endo and not pelvic floor dysfunction, which is important to rule out, is that I did physical therapy for 21 months. Nothing got better.
Yeah.
And my physical therapist also thinks I still have endo. So it is important to like talk to the rest of your care team and say like, are these symptoms more pelvic floor dysfunction, like my doctor is saying, or the expert in pelvic floor dysfunction is saying no.
Right.
So listen to your experts in each field. And so I did dry needling with that, which when I stopped doing that, my home management instead is, I would love to get like acupuncture, but I have an acupuncture mat because it's $50 instead of $200 a session.
Yes.
So I have a mat that I just lay on for a nice 10 minutes at least a day and get the spikies in my back. I love cupping. I have a couple sets at home. I even do it on my partner because he's a data entry person. So he like gets sore shoulders. So I do his shoulders. I do a lot of like, just keep going with my pelvic floor physical therapy exercises, like foam roller stuff, Kiba balls, TENS unit, which I've seen a lot. I just want to say really quick, I've seen a lot of people getting the like $200 TENS units that are like pink taxed, and like, if it's really, really your jam, that's awesome. And I'm happy for you, but just know it's the same as a $20 to $40 TENS unit that you get on Amazon or at Walgreens.
Yeah.
So just like, I put a clip on mine, so it's just as clippy as the cute ones. So definitely think about branching out and saving a little money.
Yeah.
Again, if you like those brands, like, go for it. No judgment here at all. I just want people to save money if they want to.
Everything, right. Endo is expensive.
It's expensive. Like I'm listing all these gadgets I have. Each one of them costed like money. And so, yeah, I just think that figuring out what works for you. And if you have access to like physical therapy, they can help you play with tools before you buy them.
Yeah.
And so since dry needling was so effective for me, I looked into the acupuncture mat in particular because that falls in line with that.
Yeah.
So I do those things. I eat anti-inflammatory. I try and limit stress, but it's 2021. So that's kind of hard.
Yeah.
When talking about cooking in the kitchen, I use a stool to sit on, which I'm still really bad at using. I still find myself standing every 2 minutes and then sitting back down. So that's okay. We're all wired to be productive. It's okay. I have a food processor that my family gave me. If you have access to that, it's also a game changer, because I also batch cook everything. That is the biggest tip I have. I cook everything double to triple the recipe at least, and I freeze half of what I make. And I put a little sticky on it that says what it is, the date I made it, and the day I took it out of the freezer. And that way, when I have my period, when I'm in luteal phase and I don't want to cook, I don't have to. And I can still eat anti-inflammatory. So I do supplement that with then like Kevin's chicken from Whole Foods and like the occasional slightly packaged and processed thing. But I look for the stuff that has like the least sodium, the least all those things. So it still takes a lot out of you to cook, but like it's a lot easier when you only do it like 1 week a month.
Yeah. No, it's so smart to batch cook.
Yeah.
I need you to come over. Can you come over and do that for me?
Yes. I would love, like, I'll just cook for everybody and you guys just like, I don't know, just eat it and enjoy it. Tell me it's good. That's what I like.
Yeah. Oh, that's such a good tip. Such a good tip. So it's just done and you don't have to think about it. And if you're not
even
just
something as simple as if you eat quinoa with like your chicken, go ahead and make the quinoa and freeze the quinoa because it's good for over a month in the freezer.
Right.
So
just make
like
a big batch. Yeah.
Yeah, that's good. That's because even if you still have to make the chicken later or like something like that, like you still have the quinoa. It's still half done.
Right. Exactly.
So
well, good. Well,
yeah,
talk to me about excision, right? And access to getting it and what you've done. And because I think a lot of people need help figuring this out.
So I've heard, I actually did not get it covered by my insurance. My appeal did not work, but there are some people like on Instagram that have like templates for appeals. I'm forgetting her name. But there are templates out there for appeals, and
just Google it. I feel like you can find it if you Google it. Yeah.
Yeah. And certain like, doctors help you with that. Not all, but certain doctors help you with that process as well. And so you can fight for out of network excision. You can fight for one time in network payment. That's also a thing. If your insurance will be like, okay, this one time will do it for you for this particular surgery, which is also why I am meeting with the surgeon in North Carolina who doesn't do extra pelvic, because I can hopefully convince my insurance that nobody in the state can treat me. If I confirm with her that she does not do the kind of surgeries I need.
Right.
And so that is another thing. Rule out the doctors in your area and tell why. And then finally, Chapel Hill in particular, I wouldn't recommend, but most hospitals are nonprofits, or like half of them or something. Like there's a lot of hospitals that are nonprofits, including the one in Atlanta. I don't know if I'll get in trouble for saying that. They're a nonprofit. And if you make 300% of the poverty limit often, which is like 50K, so like I think a lot of us make less than that, then you can get your excision covered by anything that your insurance does not cover. So insurance did not pay for my excision. So it would have, and I don't love, like, I don't want to be like weird talking about numbers, but I think it's important to be transparent.
Yes.
The surgery that did not work for me would have costed $17,000 because my insurance would not cover it.
Right.
So I got charity care at that hospital. That's what it's called. It's called charity care, hardship care, different things like that. And I was able to say, look, like I'm a normal 20-year-old who doesn't make that much money.
Right. And I'm in chronic pain every day of my life.
And I personally, because of my fibromyalgia and the autoimmune issues I'm dealing with, I have not been able to work for a year and a half. I got fired or almost fired from 4 jobs. I told to go ahead and move on. At jobs that I won customer service of the year, at jobs that I won associate of the quarter, like I was winning awards.
Right.
But absences are absences. And so I have not worked in a year and a half, and my partner's supporting me as I go through the disability process. Get a lawyer if you're doing that. But as you do that, you're also still proving that you don't have the financial means to cover excision surgery. And so you can often get charity care. Like I said, lots of hospitals, including ones in Atlanta, have charity care. So apply.
These are really, really helpful information, Maggie. Seriously, this will help a lot of people. Thank you for sharing that.
Absolutely.
Yeah. So unknown. I didn't know that. You just taught me that. Yeah.
So, and learning hospitals almost always are nonprofits. So if the best hospital in your state is a university hospital, it's probably got charity care.
Yeah. Yeah, that's a fantastic tip.
Yeah. And bad excision, I still believe is better than no excision if you're able to access excision. I still think that it lends way too many problems and we need better training and all those things. Yes. But it's a start to stop ablating. So I think that it's important. And a lot of learning teaching hospitals are now looking at excision. So
yeah, which is, I do think, I mean, the awareness is getting to a much better place than it's ever been. I think so many people speaking out and social media has been incredibly helpful to getting the word out of the right care and what it is and what the signs and symptoms are. And
things like this was the first podcast I listened to after my diagnosis. So that's why it's so nice to be here, because like this was at the beginning of my journey. And anytime because I fall off listening to podcasts. Like I like get in spurts. Like I read books for like 3 weeks and then I like watch TV for 3 weeks and then I listen to podcasts. So
I do the same thing.
Whenever I'm feeling like bad about my endo, I can come here and be like, okay, like, look, these are the people who have related to me since the beginning, who like are going through the same thing, who know you're not crazy. And so it's just always nice to hear other people's stories here.
I appreciate that so much. Thank you. Thank you. It's really all the brave warriors that come on and are willing to talk about it. It's not easy. So it's, well, wonderful. Let's talk about your books a little bit. So I have one, and for the people who are listening, you can't see, but I'm holding up When I Bleed. So this is poems about endometriosis. And what I told Maggie before we started recording was like, a lot of these really hit home for me. But I also felt that like people who are supporters of people who have endo really need to pick up a copy of this, or if you have endo, maybe pick one up and give it to someone that might need to
And if
read
you're
it.
shopping for somebody with endo for Christmas, like,
Very
'cause
relatable.
I feel like you need to start soon this year because, by the way, there's like a ton of shortages. So get your shopping in early.
Get it done. I mean, let me just, I wanted to read the two poems that really, I mean, a lot of them resonated
That would
with
make me want to cry. Like,
I know. But it's crazy because I would say like 10 or 15 years ago, I always have wanted to write a book about endo. It's just been on my radar. I haven't done it. I've written outlines, but 10, maybe 15 years ago, I just kept writing down things that I wanted to not forget. Because when you're in the moment, you're in the moment, right? And so this really resonated with me because I always would talk about acid. So this one's nothing but pain. There is acid pouring through my abdomen, contained poorly by barbed wires, cut only by the knife, slicing through my most tender points. I mean, that describes how I felt a million times over. So that's just one. And then there's one more. Poor Maggie. I'm
no, I'm gonna like cry. Like,
and this one I think is a good reminder for everybody who's listening, who is an endo warrior. It's called I'm Doing My Best. This is the most I have ever felt myself, and yet it is still far from enough. So I think one thing that we have to remember is you've talked about all of these things today, and I've talked about all these things, but we just do your best, diet, finding doctors, finding how hospitals do all the stuff that you've done, Maggie. It's so much time and effort when you don't.
So much time.
Right. So remember, you're going to hear this, you're going to feel so inspired because Maggie's amazing, but you don't have to do it all.
Years.
You don't have to do it all today.
Wasn't a 40-minute task like the podcast.
Right.
This is
right.
Years.
And it's okay. You know what? If you have a day, 2 days, a week, a month, you don't feel good and you didn't get those things done, that's okay too. I think one of the biggest realizations personally that I've had is self-compassion is so important. Like, I would say to a friend, like, you're overdoing it, you need to rest. Why can't I say that to myself? So
yeah, especially when you're dealing with like one of the most painful things that people can deal with in life. Like, yeah.
So tell us about your other, so where can we find this?
So this is available everywhere, and I will email you a promo code for it on my website.
Okay, we'll put it in the show notes.
Yeah, so that you guys can have a little promo if you wanted to get on my website. And then you can get it anywhere else. So it's not in stores in most places, but it is available online at Target, Barnes and Nobles, Amazon.
Amazing.
If you like supporting your indie bookstores, it's also available through indie bookstores. You can order it with them. We have a great one downtown, so I just always send people there because it's fantastic. But I also know that a lot of people live in smaller towns and things like that. So
bookshop.org. Bookshop.org, or can they get it through that? Bookshop.org. Yeah. So that finds independence and then ships it to you, which is what I typically use.
Yeah, I use IndieBound, same thing.
Okay.
So pretty much anywhere you can get my books. You can also order it to your local library, or you can ask your library to get it. I also wanted to make sure that I know that everybody's financial situation is different, and I wanted it to be as accessible as possible. And so there is a 99-cent ebook for it. So there is always going to be, it's always going to be 99 cents. That will never change. Always 99 cents. And in the back, there is also a little section that just tells you the facts about endometriosis, that like a hysterectomy doesn't cure it, but that it can manage symptoms and it cures adenomyosis. It talks about the symptoms so that people can have an eye out for those. And it gives you a few resources to go do more research and a few more books. So I wanted it to make sure that it was a resource that you have, and that, like I said, as many people as possible can access. If you have any sort of like Kindle, Apple Books, online, it's just 99 cents. And I know that can sometimes even be hard for people. So like, again, if you're struggling,
if you want it and you're struggling, email me, I'll buy it for you. Melissa@Boo Consulting.
And email me, I can work something out with you too. My email's on my website. So we'll all work it out. Like, so I want you to be able to have this because I I like want to cry when I get a message at least once a week from somebody, like what you were saying was like they saw themselves in at least one of the poems.
Yeah.
And that makes me want to cry, because all I want is for you to feel seen. Like, you're not alone in this. I think one of the pieces I wrote said like there are 200 million reasons to keep going.
Yes.
Because there's 200 million of us, and like we all need you. Like we need you in particular. Whoever's listening to this. So, because you bring something to this community and to your community and to like everyone. So, because I know mental health is really hard, and it's a struggle with endo, and that's fair. And I do write about that too, because like it is valid to have mental health struggles when you have endometriosis, and don't ever think that means it's in your head either. Like I still do therapy. It was psychological this whole time, but that's a joke. Everybody, your endo is not psychological, but I still think therapy can help if you have access, because it's a lot to deal with a chronic condition.
Yes. And if you don't have access, find people online. There's a ton of support groups. Like there are people that are willing to talk to you and help, that have been through it or have been at the beginning of the journey when it's.
And Melissa and I are both here. Like,
please,
you can just message us.
Yes.
Like, and I can also then point you to other support groups that like maybe will fit you best, because there's also different ones and they all have different vibes.
There's so many. I know.
Please just like don't feel like you don't fit in the community if you don't fit in the first support group you go to.
How can people find you, Maggie?
Yeah, so you can find me on Instagram at maggie.writes. So MAGGIE WRITES, like I'm writing your book. And so, so my book, like I said, could be available anywhere, and I'll send Melissa a coupon code for everybody.
I'll put it in the show notes.
Yes. And then, last thing I do want to say about your endo journey, and then I'll wrap it up with my last two things, my book. But basically, don't stop fighting and don't stop advocating for yourself. A perfect example is when I got my surgery at Chapel Hill, I was given black and white photos on like regular copy paper of my insides. And I kept trying to get the real photographs, and I submitted the paperwork multiple times, and I spent hours on hold with like 4 different departments, and everybody told me they don't exist. We don't do that. This, that, and the other, every excuse under the moon. They couldn't find them. I had seen them on my doctor's computer, so I knew they existed in color. They exist in color if there are photographs. I just want to tell you that. And you can see so much more in color.
Yes.
I was shocked at how much, like I knew that there were still reflections, that there was some weirdness, but the amount of veins that are disrupted like all over my abdomen was eye-opening, and it really convinced me that it is the right step for me to go to another surgeon. But I finally wrote the paper the right way, submitted it to the right person on the right day. I like super circled and underlined like colored photos, and somehow that the 5th or 6th time I requested them over 2 years, I got the colored photos on a CD. And like I said, I can see so much more endo. Yes. So it makes me more urgent to go get care, because I believe myself more now. So don't let them gaslight you. You are entitled to your records. You are entitled to pain management. You are entitled to whatever kind of treatment and symptom management you're able to access. Like, you're entitled, and you can tell them to write it down why they're not giving you a test. You can ask for a referral. You can all sorts of things. So please advocate for yourself, because it's crazy that they lie to you like that, but they're not always honest.
Be relentless. Like it sounds like you were relentless in it.
And it takes time. So like, don't blame yourself. Like Melissa was saying, if this takes a long time, like there are days that like, I don't do it for like weeks and weeks. And then I'm like, get this burst of energy, and I'm like, I'm going to call 7 places. So do it however works best for you. If it's 1 place a day, 1 place a week, 1 place a month, like do it however you can. Just get through it. You're doing the thing. You're doing your best.
Yeah, absolutely. It's great.
So, yeah. Finally, then I am coming out with this book, Ungodly,
Oh,
in
tell us about
November.
it. Oh, so
So
exciting.
yeah, so it's for a broad range of people. So I forgot Melissa was so amazing and did ask my pronouns at the beginning of the show, and I did not provide them. That was my fault.
That's
My pronouns
okay.
are they, them. I'm non-binary. And so I do use they, them pronouns. And this book is about having endo and being non-binary, being
Amazing.
LGBTQ plus in this world that thinks being disabled in a world that is built for able-bodied people and able-minded people. It's just basically being about what people consider ungodly or impure, and how those things really, and like I don't think you need to like be religious. I personally am religious, but you don't need to be religious to get this feeling. What makes us seem ungodly is what makes us the most godly of all. Like, we
Beautifully
are
said.
wonderful, amazing people because we're in this really awful club together.
Yeah. Yeah.
So it's what makes you you. So it's about broader themes than just endo. So if you're looking for endo content, When I Bleed is for you. It is definitely for you. But this is like, if you're LGBTQ plus and have endo, if you want to talk about disability in the world, if you want to think about being a survivor of sexual assault, different things like that, this is going to be there for you for that. So, and this one is 190, 200 pages. So,
oh my goodness.
Even
it looks
bigger.
Like it's done. I mean,
it's like double and it's done. So it'll be available starting in November.
Oh my goodness.
So
congratulations. You know what? You're just giving a voice and a resource for people. It's incredible. So when you say you haven't worked, you have worked. You're making a difference. You're changing. This is more important.
Yeah, and that's what my partner always tells me, that like this is doing something. So I mean, that means a lot to me, and I'm gonna probably cry after this because you're so sweet, and that's literally all I like. That's been my goal with all of this, and so to meet it with even one person is just incredible. And I really hope that other people who read it enjoy it and feel seen by it. So, and like I said, if you need help getting a copy, or if you want like a bundle deal or anything like that, please email me. I'll send Melissa all of my stuff. So
I'll put it all in the show notes, and I'm happy to help too. If you really need a book or interested in a book, we'll work something out, but I'm happy to, supply.
And libraries.
10 libraries are huge. We forget about the libraries. You're right. Libraries will order it. Like, you can check it out for free, and you can request it, and they will purchase it,
They will. So that still supports me, if that makes sense. Like, don't think that getting it at a library unsupports me. Like, that supports me too.
Yeah.
So, because I never want people to feel like with the 99-cent option, I don't want you to feel like you're taking anything from me. Like, no, this is what that's there for. Like, I want as many people to get this as possible.
Yeah. I agree. I think that this needs to get in everybody's hands and supporters. And I'm really excited to read your next book. So congratulations. You're doing incredible things.
You are too, Melissa.
Oh,
thank you for having me to do this incredible talk. Like, this has just been so fun. Well, it's always nice to talk to like-minded people and like-bodied people and people with similar experiences.
We will have you back. We'll be thinking of you during your time where you're trying to, source a new path of care. And thank you for sharing everything you said and all these resources. It really is going to help a lot of people. I really appreciate you coming on.
Absolutely. This was fantastic. And thank you again for having me. And I hope everybody's having a high spoons, low pain day, low symptoms, whatever you're dealing with. So
yeah, absolutely. Take care, everyone.